Question 71. A technician is preparing to manually brush a newly purchased flexible bronchoscope at the decontamination sink. They need the exact step-by-step instructions for the enzymatic soaking time. Which entity is legally mandated to author and supply these specific processing parameters? Option A. The facility assigned operating room nurse manager. Option B. The Professional Association for Gastroenterology Nurses. Option C. The specific commercial manufacturer of the bronchoscope. Option D. The National Infection Control and Epidemiology Committee. Correct answer C. Knowledge point explanation. Core rationale. The Federal Oversight Agency strictly requires the commercial manufacturer of any medical device to extensively test, validate, and publish the exact step-by-step instructions for use regarding its safe cleaning and sterilization. Sterile processing technicians must blindly follow these specific manufacturer instructions as they hold the weight of federal law. Trap analysis. Option A. This is wrong for this scenario because clinical nurse managers do not engineer the devices or test their chemical compatibility. This would be the correct answer if the technician needed to know the specific surgical suite schedule for when the bronchoscope would be utilized on a patient. Option B. This is wrong for this scenario because professional associations publish broad generalized best practice guidelines for their specialty, not device-specific cleaning manuals. This would be the correct answer if the technician was researching the overall recommended layout and workflow design for a newly built endoscopy reprocessing suite. Option D. This is wrong for this scenario because this committee sets broad hospital-wide epidemiological policies like hand-washing enforcement, not precise enzymatic soaking times for a specific camera brand. This would be the correct answer if the question asked which organization provides the foundational research for managing a sudden outbreak of methicillin-resistant Staphylococcus aureus in the intensive care unit. Concept extension. If a device arrives without its instructions for use, the technician must completely halt the processing workflow, safely quarantine the item, and contact the vendor to obtain the official manual before proceeding. Question 72. While wrestling a massive 15-pound bariatric laparoscopic tray onto the lighted inspection workstation, an SP technician must carefully examine the tiny internal lumens of the extended shafts. Why do these extremely narrow and difficult-to-clean instruments provide a primary physiological benefit to the surgical patient? Option A. It drastically decreases the overall financial billing cost for the patient. Option B. It significantly reduces the duration required for the patient postoperative healing. Option C. It ensures the patient can always be discharged on the exact same day as the procedure. Option D. It substantially reduces the total quantity of surgical tools needed on the sterile field. Correct answer B. Knowledge point explanation. Core rationale. Minimally invasive surgery utilizes tiny incisions to insert cameras and long instruments, avoiding the massive tissue trauma associated with slicing open the human abdomen. Because the physical tissue damage is drastically minimized, the patient experiences significantly less pain and enjoys a much shorter recovery time. Trap analysis. Option A. This is wrong for this scenario because minimally invasive procedures frequently cost much more due to the highly expensive technological equipment, robotic consoles, and specialized disposable trocars required. This would be the correct answer if the question asked about the primary administrative benefit of standardizing all basic suture scissors across the entire facility to a single, cheaper brand. Option C. This is wrong for this scenario because complex minimally invasive procedures such as robotic prostate removals still routinely require overnight hospital observation. This would be the correct answer if the question asked to identify the defining logistical characteristic of a dedicated freestanding ambulatory surgery center. Option D. This is wrong for this scenario because these surgeries often require a massive amount of equipment, including cameras, light cords, insufflation tubing, and multiple specialty graspers in addition to a basic open tray just in case. This would be the correct answer if the technician was asked about the main advantage of actively purging in used obsolete clamps from an overcrowded orthopedic set. Concept extension. The internal lumens and delicate insulation coating of these minimally invasive instruments demand rigorous inspection at the lighted workstation, as any defect can cause severe internal electrical burns to the patient internal organs. Question 73. An SP technician is pushing a fully loaded 300-pound closed case cart down the main hospital corridor toward the surgical elevators. If they encounter a group of visitors and a patient being pushed in a wheelchair, what is the mandatory physical action the technician must take? Option A. Keep moving and pass the individuals safely on their left side. Option B. Stop the cart, pull it to the side, and grant the individuals the right of way. Option C. Request that a departmental supervisor escort the cart through the congested area. Option D. Keep moving and pass the individuals safely on their right side. Correct answer B. Knowledge point explanation. Core rationale. Transporting heavy carts through public facility hallways introduces severe physical safety hazards. The fundamental rule of customer service and safety in a healthcare environment dictates that the technician must immediately halt their movement, secure the heavy cart safely against the wall, and yield the right of way to all patients and visitors to prevent accidental collisions. Trap analysis. Option A. This is wrong for this scenario because aggressively pushing a heavy cart past vulnerable pedestrians is inherently dangerous and violates strict facility etiquette. This would be the correct answer if the question asked about standard traffic flow rules for motorized vehicles on a public roadway in specific countries. Option C. This is wrong for this scenario because transporting case carts is a routine daily task that fully trained technicians perform independently without requiring managerial escorts. This would be the correct answer if the technician discovered a massive uncontained spill of a highly toxic liquid chemical sterilant flooding the hallway. Option D. This is wrong for this scenario because attempting to navigate around a wheelchair with a 300-pound blind spot object risks causing severe injury to the patient. This would be the correct answer if a technician was simply walking empty-handed down a standard hallway and adhering to basic pedestrian traffic flow. Concept extension. When transporting case carts, the technician must always push the cart from the designated handles rather than pulling it, ensuring they have maximum visibility and physical control over the rolling mass to prevent running over their own feet. Question 74. While physically scanning the instrument tracking system to pull specific tools for a scheduled cholecystectomy, an assembly technician breaks down the procedural word on the printed pick list to ensure they select the correct tissue-removing instruments. In the structural anatomy of this medical term, what is the specific classification for the final linguistic element ectomy? Option A. The structural prefix. Option B. The foundational root. Option C. The combining vowel. Option D. The procedural suffix. Correct answer D. Knowledge point explanation. Core rationale. In medical terminology, words are constructed like building blocks. The suffix is explicitly defined as the word element attached to the very end of a root word to alter or specify its meaning. In this case, the suffix ectomy specifically translates to the surgical removal or excision of an anatomical structure. Trap analysis. Option A. This is wrong for this scenario because a prefix is positioned at the beginning of the word to modify conditions like time or location. This would be the correct answer if the technician was asked to identify the structural role of the linguistic element peri in the word perioperative. Option B. This is wrong for this scenario because the root dictates the core body part, not the action taking place at the end of the word. This would be the correct answer if the technician was asked to identify the structural role of the linguistic element cholecyst representing the gallbladder. Option C. This is wrong for this scenario because a combining vowel is merely a letter used to seamlessly bridge two harder word elements together. This would be the correct answer if the technician was asked to identify the structural role of the letter O connecting the two roots in the word gastroenterology. Concept extension. A cholecystectomy relies heavily on minimally invasive instruments, therefore the technician must ensure the tray contains fully functional laparoscopic clip pliers to secure the bleeding vessels once the gallbladder is excised. Question 75. a technician is submerged up to their elbows in a decontamination sink utilizing a nylon bristled tool to remove dried bioburden from the hinged joint of a heavy bone rongeur. To effectively dislodge the soil without creating hazardous aerosols, what precise physical motion must the technician employ with the brush? Option A, a continuous rapid circular scrubbing motion. Option B, a steady back and forth scrubbing motion. Option C, a vigorous upward flicking motion. Option D, a forceful side-to-side twisting motion. Correct answer B. Knowledge point explanation. Core rationale, manual cleaning requires specific mechanical action to break the bonds of dried bioburden. Industry guidelines strictly mandate utilizing a steady to and fro or back and forth motion while keeping the instrument completely submerged under the waterline. This linear friction effectively sweeps the soil out of the crevices while the submersion prevents infectious droplets from becoming airborne. Trap analysis. Option A. This is wrong for this scenario because circular motions merely smear the bioburden around the surface of the instrument rather than actively sweeping it out of the box lock. This would be the correct answer if the technician was utilizing a specialized motorized rotary buffer to polish the flat, solid stainless steel surface of an instrument during a dedicated refurbishment process. Option C. This is wrong for this scenario because flicking the bristles upward violently forcefully ejects microscopic droplets of contaminated water directly into the technician face shield. This would be the correct answer if the question asked to describe the obsolete historical method of manually resetting the mercury level in an old-fashioned glass thermometer. Option D. This is wrong for this scenario because twisting the brush bristles causes them to bind and warp against the hinge without effectively dislodging the compacted soil. This would be the correct answer if the technician was utilizing a flexible wire pipe cleaner to physically bore through a completely occluded hardened blockage inside a rigid suction lumen. Concept extension. The nylon brush bristles must be rigorously inspected before use. If the bristles are splayed, bent, or visibly worn down, the friction necessary for the back and forth action will be lost, rendering the cleaning process entirely ineffective. Question 76. While organizing the sterile storage room, an SP technician places a large wrapped orthopedic tray on a wire rack, leaving 2 inches of the tray protruding past the edge of the shelf. What is the primary infection control risk associated with this specific storage practice? Option A. The protruding package is exposed to physical strikes and environmental dust leading to contamination. Option B. It creates a severe gravitational imbalance causing the entire shelving unit to instantly tip over. Option C. It prevents the internal chemical indicators from properly oxidizing during the ambient cooling phase. Option D. It traps residual moisture within the synthetic wrapper, creating a permanent wet pack. Correct answer A. Knowledge point explanation. Core rationale. Aseptic storage principles dictate that all sterile items must be fully contained within the physical boundaries of the shelving unit. Trays that overhang the edge are highly susceptible to being bumped by passing transport carts or personnel, and they intercept falling dust from the aisles, which directly compromises the integrity of the sterile barrier. Trap analysis. Option B. This is wrong for this scenario because a 2-inch overhang of a single tray will not collapse a commercial-grade floor-mounted storage rack. This would be the correct answer if the technician was loading massive 80-pound heavy-duty rigid containers exclusively onto the very top shelf of a lightweight narrow-wheeled cart. Option C. This is wrong for this scenario because chemical indicators react to heat and sterilant inside the chamber, not ambient air exposure during storage. This would be the correct answer if the question asked what happens when a rapid readout biological indicator is deprived of its specific enzymatic activation fluid during incubation. Option D. This is wrong for this scenario because overhanging a shelf actually increases ambient airflow around the pack rather than trapping moisture. This would be the correct answer if the technician was stacking hot, freshly sterilized flat-wrapped surgical trays tightly on top of one another on a solid metal table. Concept extension. Sterile packages must also be kept at least 2 inches away from exterior walls to prevent condensation caused by temperature differentials from wicking into the wrappers. Question 77. prior to loading a heat-sensitive polymer endoscope into a low-temperature sterilizer, an SP technician reviews the manufacturer manual to confirm material compatibility. In the context of sterile processing, what does this specific compatibility verification ensure? Option A, that the chosen sterilant will not physically degrade the device or alter its intended clinical functionality. Option B, that the medical device will actively absorb the maximum volume of chemical sterilant during the exposure phase. Option C, that the instrument will automatically prevent the mechanical sterilizer from aborting its programmed cycle. Option D, that the device can be safely mixed with highly absorbent linen packs within the same load. Correct answer A. Knowledge point explanation. Core rationale. Material compatibility is a critical safety assessment ensuring that the specific chemical gas or plasma used in the sterilizer will not melt, warp, or corrode the instrument. The ultimate goal is to guarantee that after the cycle is complete, the surgical device looks and functions exactly as it did before processing with zero negative alterations. Trap analysis. Option B. This is wrong for this scenario because instruments should never absorb the sterilant. Absorption damages the item and traps toxic residues. This would be the correct answer if the technician was asked to explain why standard cellulose paper pouches are strictly incompatible with hydrogen peroxide processing. Option C. This is wrong for this scenario because compatibility means the machine can run safely but the instrument itself does not possess mechanical control over the sterilizer sensors. This would be the correct answer if the question asked about the function of a properly calibrated internal moisture sensor actively regulating the vacuum pressure inside the chamber. Option D. This is wrong for this scenario because low-temperature systems generally prohibit the use of highly absorbent linens as they disrupt the chemical concentration. This would be the correct answer if the technician was discussing the acceptable loading parameters for a standard gravity displacement steam cycle processing general surgical textiles. Concept extension. If an SP technician processes an incompatible flexible endoscope in a steam autoclave, the intense 270 Fahrenheit heat will instantly melt the polymer insertion tube, destroying a piece of capital equipment worth tens of thousands of dollars. Question 78. An operating room nurse delivers a tray of soiled stainless steel retractors to the decontamination window, noting they submerged the items in a specific clear clinical fluid at the point of use to keep them moist. Which liquid must the technician instantly recognize as highly corrosive and damaging to the surgical instruments? Option A. Sodium chloride saline solution. Option B. Highly purified deionized critical water. Option C. A commercially prepared enzymatic detergent spray. Option D. A lipolytic wash solution designed to target adipose tissue. Correct answer A. Knowledge point explanation. Core rationale. Saline is heavily utilized in surgery for patient irrigation, but its high salt content makes it extremely corrosive to the protective passive layer of surgical-grade stainless steel. If instruments are soaked in saline, the salt aggressively eats into the metal, causing severe pitting, permanent rust, and structural degradation. Trap analysis. Option B. This is wrong for this scenario because deionized water is completely free of minerals and halogens, making it the safest possible fluid for instruments. This would be the correct answer if the question asked for the ideal mandated liquid used in the final rinse phase to prevent mineral spotting on shiny surfaces. Option C. This is wrong for this scenario because enzymatic foams are scientifically engineered specifically to be universally safe and non-corrosive to metal surfaces while breaking down blood. This would be the correct answer if the question asked for the manufacturer-approved preferred chemical intervention used to safely halt bioburden degradation at the point of use. Option D. This is wrong for this scenario because lipolytic detergents are approved cleaners that safely target fat cells without damaging the underlying steel. This would be the correct answer if the technician was selecting a specific specialized detergent to process heavily soiled instruments returning from a massive bariatric liposuction procedure. Concept extension. If a technician receives instruments soaked in saline, they must immediately remove them, thoroughly flush the items with copious amounts of tap water to dilute the salt, and actively brush the box locks to halt the galvanic corrosion process. Question 79. An SP technician is summoned to the substerile core to perform an immediate-use steam sterilization cycle on a cranial clamp that was just dropped onto the operating room floor. What critical physical step must the technician execute before placing this item into the sterilizer chamber? Option A. The instrument must undergo a rigorous complete manual cleaning process according to its specific instructions for use. Option B. The instrument must be thoroughly soaked in a high-level liquid disinfectant for 20 minutes. Option C. The instrument must be packaged in a dual-layer standard paper plastic peel pouch. Option D. The instrument must be heated in a thermal drying cabinet to eliminate all ambient moisture. Correct answer A. Knowledge point explanation. Core rationale. The golden rule of the sterile processing industry is that sterilization cannot occur without thorough cleaning. Even in a life-or-death surgical emergency, an instrument dropped on the floor accumulates microscopic bioburden and dust. The technician must execute a complete manual decontamination wash to remove this soil before the steam can successfully reach the metal surfaces. Trap analysis. Option B. This is wrong for this scenario because high-level disinfection is not a substitute for cleaning, nor is it the correct process for a critical device entering sterile tissue. This would be the correct answer if the technician was processing a semi-critical flexible laryngoscope for a routine airway examination. Option C. This is wrong for this scenario because standard paper plastic pouches are not validated for immediate use cycles, lacking a dry time, as the wet paper will instantly wick bacteria. This would be the correct answer if the technician was preparing a lightweight hemostat for a standard terminal sterilization cycle aimed at long-term shelf storage. Option D. This is wrong for this scenario because immediate use cycles utilize wet steam and do not require the item to be bone dry prior to the cycle. This would be the correct answer if the technician was preparing an intricate robotic camera cord for a vaporized hydrogen peroxide gas plasma cycle, which immediately aborts if moisture is detected. Concept extension. Facilities must equip their substerile rooms with the proper multi-base sinks, approved enzymatic detergents, and appropriate lumen brushes to ensure technicians have the physical resources required to clean items adjacent to the operating room. Question 80. A sterile processing technician is meticulously donning their personal protective equipment in the locker room, taking special care to secure their fluid-resistant shoe covers. They mentally review the facility infection control protocols regarding a specific fungal infection that thrives in damp environments like locker rooms and showers. Which specific biological condition is the technician actively trying to prevent? Option A. Tinea pedis, commonly known as athlete's foot. Option B. A severe lower respiratory infection known as tuberculosis. Option C. An acute viral inflammation of the liver known as hepatitis B. Option D. A transmissible neurological disorder known as Creutzfeldt-Jakob disease. Correct answer A. Knowledge point explanation. Core rationale. Sterile processing microbiology requires recognizing different classifications of pathogens. A fungus is a unique type of microorganism that flourishes in dark, warm, and moist areas. Tinea pedis is a highly common fungal infection of the skin on the feet that technicians must actively avoid by utilizing proper footwear and maintaining strict personal hygiene in changing areas. Trap analysis. Option B. This is wrong for this scenario because tuberculosis is a disease caused by a highly contagious airborne bacterium, not a fungus contracted through wet floors. This would be the correct answer if the technician was donning a highly specialized N95 particulate respirator mask prior to entering a negative pressure patient isolation room. Option C. This is wrong for this scenario because hepatitis is caused by a bloodborne virus, not an environmental fungus. This would be the correct answer if the technician was reviewing the specific pathogen targeted by the mandatory employer-provided vaccination series required for all decontamination staff handling surgical sharps. Option D. This is wrong for this scenario because this disease is caused by an abnormal misfolded prion protein found in nerve tissue, not a fungus. This would be the correct answer if the technician was reviewing the extreme extended sterilization cycle parameters required for instruments used on a high-risk brain biopsy patient. Concept extension. While viruses require a living host to replicate, fungi can easily survive and reproduce on inanimate environmental surfaces, highlighting the critical importance of utilizing EPA-registered environmental disinfectants on locker room benches and shower floors. Question 81. An SP technician finishes manually brushing a bloody orthopedic reamer at the decontamination sink and prepares to transition to the staff break room for lunch. Before physically crossing the departmental threshold, what comprehensive hand hygiene protocol must they execute? Option A. Exclusively after handling visibly soiled instruments retrieved from the operating room. Option B. Strictly prior to donning latex-free examination gloves for the clean inspection phase. Option C. Upon entering or leaving any processing area and before or after designated break periods. Option D. Only upon initial entry into the central department at the beginning of the morning shift. Correct answer C. Knowledge point explanation. Core rationale. Hand hygiene is the single most effective intervention to halt the transmission of healthcare-associated infections. Technicians must wash their hands at all critical transition points, including arriving at the facility before starting work, whenever shifting between dirty and clean functional areas, and immediately before and after eating or using the restroom. Trap analysis. Option A. This is wrong for this scenario because hand hygiene is mandatory after removing personal protective equipment, regardless of whether the instruments were visibly bloody or appeared clean. This would be the correct answer if the question asked when a technician should immediately change a punctured glove and perform an emergency hand wash while working at the sink. Option B. This is wrong for this scenario because hand hygiene is required continuously throughout the shift, not just before donning gloves. This would be the correct answer if the technician was asked to identify the absolute final physical preparation step immediately preceding the handling of sterile surgical implants in the operating theater. Option D. This is wrong for this scenario because washing hands only once in the morning allows massive microbial accumulation throughout the remainder of the workday. This would be the correct answer if the question asked when a technician must clock into the facility timekeeping software. Concept extension. Alcohol-based hand rubs can be utilized for routine hand hygiene in the clean areas, but if a technician's hands become visibly soiled, they must physically wash with soap and running water to mechanically remove the debris. Question 82. After incubating a rapid readout biological indicator vial from a recent 270° Fahrenheit steam cycle, a technician observes a distinct color change in the liquid media, indicating a positive failure result. What specific biological event has occurred inside this vial to trigger this reading? Option A. The chemical dye evaporated and condensed due to extreme incubator heat. Option B. The highly resistant test spores successfully metabolized and reproduced. Option C. The test spores were completely eradicated and physically dissolved. Option D. The automated incubation cycle successfully reached its programmed continuous heating duration. Correct answer B. Knowledge point explanation. Core rationale. A biological indicator contains living highly resistant bacterial spores. If the sterilization cycle fails to deliver lethal thermal energy, the surviving spores will metabolize the sugars in the surrounding growth media during incubation. This metabolic growth produces an acid that fundamentally alters the pH of the fluid, causing the pH indicator dye to change color and signal a positive failure. Trap analysis. Option A. This is wrong for this scenario because the color change is driven by microbial metabolism and pH shifts, not thermal evaporation. This would be the correct answer if the technician placed a standard external chemical indicator tape directly against a blazing hot radiator pipe, causing the ink to scorch. Option C. This is wrong for this scenario because eradicated spores do not produce acid. A successful kill results in a negative reading with no color change. This would be the correct answer if the question asked what physical state the spores are in when the incubator registers a perfectly clean passing negative result. Option D. This is wrong for this scenario because the color change indicates active microbial life, not simply the expiration of a digital timer. This would be the correct answer if the question asked what triggers the green completion light to illuminate on the exterior casing of the heating block device. Concept extension. A positive biological result mandates the immediate initiation of a massive recall protocol pulling back all trays processed since the last known negative test to prevent contaminated tools from reaching patients. Question 83. An SP technician is actively loading a sterilization cart when a team of federal inspectors suddenly enters the department unannounced to physically examine the facility biological indicator logbooks. If the technician records show severe safety violations, which specific federal agency holds the power to instantly revoke the hospital government financial funding? Option A. The International Organization for Standardization. Option B. The National Committee for Quality Assurance. Option C. The Centers for Medicare and Medicaid Services. Option D. The Hospital Consumer Assessment of Healthcare Providers and Systems. Correct answer C. Knowledge point explanation. Core Rationale. The Centers for Medicare and Medicaid Services is the powerful federal agency that controls government healthcare funding. To ensure hospitals are maintaining patient safety, they conduct unannounced inspections to verify that facilities are strictly following infection control standards. Failure to pass these surveys can result in the immediate termination of federal funding, which effectively bankrupts a hospital. Trap analysis. Option A. This is wrong for this scenario because this is an international group that publishes quality management frameworks, not a United States federal agency capable of withholding Medicare funds. This would be the correct answer if the manager was striving to achieve a globally recognized 9001 certification plaque to display in the hospital lobby. Option B. This is wrong for this scenario because this organization primarily accredits individual health insurance plans and provider networks, not physical hospital sterilization departments. This would be the correct answer if the Facility Billing Administration was seeking accreditation for a newly established managed care health plan. Option D. This is wrong for this scenario because this is a standardized patient satisfaction survey tool used to collect data, not a physical inspection agency that audits sterilization logs. This would be the correct answer if the question asked what specific questionnaire data the hospital uses to evaluate whether floor nurses are communicating effectively with recovering patients. Concept extension. The Joint Commission frequently conducts surveys on behalf of the Centers for Medicare and Medicaid Services, acting as their enforcement arm to meticulously audit sterile processing records for any lapses in quality control. Question 84. A technician is utilizing a handheld barcode scanner in the sterile storage room, manually requesting boxes of indicator tape from the supply chain department to bring the current shelf quantity exactly back up to a predetermined optimal threshold. What is the precise terminology for this specific inventory replenishment methodology? Option A. The periodic automatic replenishment system. Option B. The individualized surgical case cart system. Option C. The on-demand clinical requisition system. Option D. The bulk external vendor exchange system. Correct answer A. Knowledge point explanation. Core rationale. In supply chain management, establishing a predefined maximum quantity for a stocked item creates a baseline. When an employee reviews the shelf and orders enough supplies to bring the depleted stock exactly back up to this established baseline, they are executing a periodic automatic replenishment system, universally known as a PAR system. Trap analysis. Option B. This is wrong for this scenario because this method builds custom carts for isolated patient surgeries, not general bulk shelf restocking. This would be the correct answer if the technician was packing specific specialized retractors and gowns onto a covered trolley for a scheduled appendectomy. Option C. This is wrong for this scenario because requisitions are ad hoc requests for unique items not kept in standard inventory. This would be the correct answer if the technician was filling out a special digital request form to order a highly unusual size of sterile mesh that the department never routinely stocks. Option D. This is wrong for this scenario because an exchange system involves physically swapping two identical fully loaded carts rather than scanning individual boxes on a static shelf. This would be the correct answer if the technician pushed an empty supply cart down to the basement and immediately swapped it for an identical fully restocked rolling rack. Concept extension. Setting the threshold too high traps vital hospital capital in idle boxes of supplies while setting it too low guarantees that the department will run out of critical indicators mid-shift. Question 85. An SP technician retrieves an intravenous infusion pump from a highly contagious isolation ward. The plastic housing looks completely spotless and has no visible fluid marks. How must the technician legally classify and physically handle this specific piece of returned mobile equipment? Option A. As clinically clean and ready for immediate patient distribution. Option B. As biologically contaminated and requiring full personal protective equipment. Option C. As a non-critical device requiring only a visual safety inspection. Option D. As medically sterile until the power cord is physically plugged into an outlet. Correct answer B. Knowledge point explanation. Core rationale. The absolute cornerstone of infection control dictates that visual cleanliness is entirely irrelevant. Any piece of patient care equipment including mobile infusion pumps that crosses the threshold into a patient room must be assumed to be covered in infectious microscopic pathogens. The technician must classify it as contaminated and handle it using robust personal protective equipment until it undergoes formal decontamination. Trap analysis. Option A. This is wrong for this scenario because deploying equipment without chemically disinfecting it guarantees cross-contamination to the next vulnerable patient. This would be the correct answer if the technician was retrieving a brand new pump directly from its sealed factory shipping box before it ever entered a clinical wing. Option C. This is wrong for this scenario because while a pump is a non-critical device, it requires stringent chemical disinfection using an EPA-registered wipe, not merely a visual glance. This would be the correct answer if the question asked to describe the physical processing required for a clean brand new clipboard used solely by the unit secretary at the front desk. Option D. This is wrong for this scenario because plugging in a cord activates electricity. It has zero impact on the biological status of the external housing. This would be the correct answer if the question asked when a newly purchased pre-sterilized electrocautery pencil technically transitions from a dormant state to an active surgical energy source. Concept extension. When manually disinfecting electronic patient care equipment, technicians must never spray the liquid chemical directly onto the display screen as the fluid can seep through the bezel and destroy the internal circuit boards. Question 86. A technician is preparing to mix a fresh basin of high-level disinfectant and needs to verify the exact contact time and active ingredients printed on the manufacturer chemical jug. Which specific federal agency actively regulates these liquid chemical sterilants and strictly mandates these exact labeling requirements? Option A. The Occupational Safety and Health Administration. Option B. The Centers for Disease Control and Prevention. Option C. The Environmental Protection Agency. Option D. The Association for the Advancement of Medical Instrumentation. Correct answer C. Knowledge point explanation. Core rationale. The Environmental Protection Agency classifies liquid chemical disinfectants and sterilants used on environmental surfaces and medical devices as antimicrobial pesticides. Because of this classification, the agency legally regulates the manufacturing process and strictly dictates the mandatory safety and efficacy information that must appear on the product label. Trap analysis. Option A. This is wrong for this scenario because this agency regulates the safety of the employee handling the chemical, not the commercial label on the jug itself. This would be the correct answer if the technician was looking up the mandated location for the facility emergency eyewash station. Option B. This is wrong for this scenario because this is a scientific advisory organization that provides infection prevention guidelines, but it has no legal regulatory authority to approve chemical product labels. This would be the correct answer if the technician was researching the widely adopted Spalding classification system for processing medical devices. Option D. This is wrong for this scenario because this is a voluntary standard-setting association, not a federal regulatory body with the legal power to mandate chemical manufacturing labels. This would be the correct answer if the technician was referencing the Comprehensive National Consensus Standards for Steam Sterilization and Sterility Assurance. Concept extension. The Environmental Protection Agency registration number prominently displayed on the label proves that the chemical has been federally tested and approved to kill the specific pathogens listed in its instructions for use. Question 87. While physically arranging delicate bayonet forceps onto a craniotomy tray, an SP technician visualizes the surgical site to ensure they include the correct microsuction tips for the largest uppermost portion of the human brain. Which specific anatomical structure are they preparing to accommodate? Option A, the brainstem. Option B, the cerebellum. Option C, the cerebrum. Option D, the pituitary gland. Correct answer C. Knowledge point explanation. Core rationale. Sterile processing technicians must possess a fundamental understanding of human anatomy to anticipate the types of tissues they will encounter. The cerebrum is the massive, highly folded upper region of the brain that fills the majority of the cranial cavity and governs all conscious actions, sensory processing, and intellect. Trap analysis. Option A. This is wrong for this scenario because this is the lower stalk-like structure connecting the brain to the spinal cord. This would be the correct answer if the technician was asked to identify the anatomical structure responsible for controlling involuntary autonomic functions like breathing and heart rate. Option B. This is wrong for this scenario because this is the smaller separate structure located at the lower back of the skull. This would be the correct answer if the technician was asked to identify the specific anatomical center that coordinates muscular balance and physical movement. Option D. This is wrong for this scenario because this is a tiny pea-sized endocrine structure, not the massive uppermost portion of the brain. This would be the correct answer if the technician was asked to identify the master gland located at the base of the brain that secretes regulating hormones. Concept extension. Instruments utilized on the cerebrum and surrounding central nervous system tissues pose the highest theoretical risk for transmitting prion diseases, requiring the most rigorous tracking and decontamination protocols. Question 88. An SP technician is preparing to position a biological indicator vial inside a fully loaded gravity displacement steam sterilizer. To accurately challenge the cycle and ensure a worst-case scenario test, the technician must place the vial in the absolute coolest physical area of the chamber, which is located exactly where? Option A. Along the interior rubber door gasket. Option B. Directly over the internal chamber drain. Option C. Deep inside the outer steam-filled jacket. Option D. Suspended freely in the exact center of the chamber. Correct answer B. Knowledge point explanation. Core rationale. In steam sterilization physics, cold air is significantly heavier than hot steam. As steam fills the chamber from the top, it physically pushes the heavier, colder air down to the bottom. Because the bottom drain is the absolute last place the cold air exits the machine, the area directly over the drain is mathematically the coolest spot in the entire chamber. Trap analysis. Option A. This is wrong for this scenario because the gasket seals the door but is heated by the surrounding metal frame. This would be the correct answer if the technician was identifying the specific sterilizer component that must be wiped daily with a damp, lint-free cloth to prevent brittle cracking and steam leaks. Option C. This is wrong for this scenario because the jacket is the intensely hot outer shell utilized to preheat the internal walls. This would be the correct answer if the question asked which structural component prevents severe internal condensation from forming when steam initially strikes the cold chamber walls. Option D. This is wrong for this scenario because the center of the chamber mixes with steam rapidly and does not represent the greatest challenge to lethality. This would be the correct answer if the technician was positioning a wireless data logger inside a completely empty automated washer disinfector to map the interior spray coverage. Concept extension. If the internal chamber drain becomes clogged with stray instrument tags or lint, the cold air cannot escape, completely trapping the cold spot and virtually guaranteeing a massive biological failure for that cycle. Question 89. A technician in the clean assembly area is utilizing 70% isopropyl alcohol to manually wipe down a non-critical piece of patient care equipment. To achieve a scientifically reasonable and legally validated level of intermediate level disinfection, how long must the technician ensure this rapidly evaporating chemical remains visibly wet on the surface? Option A, 1 to 2 minutes. Option B, 2 to 3 minutes. Option C, 5 to 10 minutes. Option D, 10 to 20 minutes. Correct answer C. Knowledge point explanation. Core rationale. Disinfectants do not kill instantly on contact. They require sustained wet interaction to break down microbial cell walls. Isopropyl alcohol acts as an intermediate level disinfectant, but because it evaporates exceptionally fast, the technician must continuously reapply the chemical to ensure the surface remains completely wet for the universally accepted 5 to 10 minute contact time frame. Trap analysis. Option A. This is wrong for this scenario because 1 to 2 minutes is vastly insufficient for alcohol to destroy resistant viruses and mycobacteria. This would be the correct answer if the technician was utilizing a highly aggressive modern proprietary accelerated hydrogen peroxide wipe specifically validated for an ultra-fast surface turnaround. Option B. This is wrong for this scenario because this duration falls short of the required threshold for intermediate level efficacy utilizing standard alcohol. This would be the correct answer if the question asked for the absolute minimum contact time required by some specific brands of quaternary ammonium surface wipes against highly susceptible vegetative bacteria. Option D. This is wrong for this scenario because maintaining wet alcohol on a surface for 20 minutes is practically impossible and entirely unnecessary for intermediate level disinfection. This would be the correct answer if the technician was fully submerging a semi-critical laryngoscope blade into a basin of liquid glutaraldehyde to achieve high-level disinfection. Concept extension. Utilizing alcohol below a 60% concentration or above a 90% concentration drastically reduces its biocidal efficacy as water must be present in the solution to actively denature the microbial proteins. Question 90. An SP technician is tasked with pushing a fully loaded transport cart of freshly sterilized trays to a newly constructed sterile storage zone. To prevent massive airborne contamination of the wrapped instruments, the technician must strictly refuse to unload the cart if the new storage room is physically located in which specific environmental area? Option A. A restricted room located completely away from the sterilization cooling area. Option B. A secure zone directly accessible from the internal staff breakout area. Option C. A designated space located directly adjacent to the prep and packaging area. Option D. An open area directly accessible from an unrestricted external public hallway. Correct answer D. Knowledge point explanation. Core rationale. The sterile storage area holds the facility's most critical and vulnerable inventory. Environmental standards mandate that this zone must be heavily restricted and shielded from external contamination. Placing sterile storage adjacent to an open, unrestricted public hallway allows massive influxes of unregulated foot traffic, airborne dust, and unmonitored humidity changes, totally compromising the sterile barriers. Trap analysis. Option A. This is wrong for this scenario because sterile storage must be separated from the intense heat and humidity generated by the active autoclaves. This would be the correct answer if the question asked to identify the most ideal and compliant architectural location for housing sterile inventory. Option B. This is wrong for this scenario because while break rooms contain food and should be separated from sterile goods, an internal restricted breakout area is infinitely safer than an uncontrolled public corridor. This would be the correct answer if the manager was asked to identify a location that violates local health codes regarding food proximity to medical supplies but is not the absolute worst public infection risk. Option C. This is wrong for this scenario because placing the storage area directly next to the clean assembly side is the standard optimized logistical workflow. This would be the correct answer if the manager was asked to identify the most efficient physical layout that minimizes excessive handling and transport distances for newly sterilized trays. Concept extension. To maintain positive air pressure and prevent airborne pathogens from drifting inward, the doors to the sterile storage area must be kept strictly closed at all times when not actively transporting carts. Question 91. A technician in the decontamination area begins reprocessing a flexible colonoscope that was just utilized in a gastrointestinal procedure. When adhering strictly to the manufacturer extensive cleaning manual, what defining characteristic of this specific instrument workflow must the technician anticipate? Option A. The manual brushing and flushing of the internal channels will demand a significantly extended, meticulous, and labor-intensive duration. Option B. The device must be entirely submerged into an active ultrasonic cavitation basin to successfully dislodge internal soils. Option C. The external insertion tube possesses a highly durable impact-resistant coating that prevents accidental handling damage. Option D. The finalized item must be routed to the high-temperature steam autoclave to achieve terminal sterility. Correct answer A. Knowledge point explanation. Core rationale. Flexible endoscopes are considered the most complex medical devices to clean due to their delicate materials, tiny moving parts, and incredibly long narrow internal channels. The manual cleaning phase, which includes precise leak testing, multi-step brushing, and repeated fluid flushing, is an exceptionally time-consuming process that cannot be rushed without jeopardizing patient safety. Trap analysis. Option B. Ultrasonic cavitation utilizes intense sound waves that will instantly shatter the fragile glass fiber optics and micromechanisms inside a flexible endoscope. This would be the correct answer if the technician was processing a heavily soiled stainless steel orthopedic hinged clamp. Option C. Flexible endoscopes are incredibly delicate, expensive, and notoriously easy to damage if bumped or coiled too tightly. This would be the correct answer if the question asked to describe the physical properties of a solid stainless steel surgical mallet. Option D. Traditional flexible endoscopes are highly heat sensitive and will melt inside a pressurized steam chamber. This would be the correct answer if the technician was routing a standard rigid metal laparoscope for terminal sterilization. Concept extension. Because the manual cleaning process is so lengthy and prone to human error, technicians must utilize lighted magnification and specialized borescopes to visually verify that the internal lumens are completely free of residual debris before initiating high-level disinfection. Question 92. An SP technician pushes a massive enclosed case cart holding 15 heavy multi-tray sets directly into the decontamination area elevator. While the department routinely processes tools for the entire healthcare facility, which specific clinical area generates the vast majority of this highly complex physical processing workload? Option A. The ground floor emergency and trauma department. Option B. The maternal labor and delivery clinical ward. Option C. The centralized supply chain management distribution warehouse. Option D. The primary surgical operating room suites. Correct answer D. Knowledge point explanation. Core rationale. While central sterile processing services auxiliary clinics and wards, the primary operating room is always the department's largest and most demanding customer. The operating room utilizes the highest volume of surgical instrumentation, requiring massive intricate trays that drive the core workflow, budgetary focus, and daily staffing requirements of the sterile processing team. Trap analysis. Option A. Emergency departments utilize sterile supplies but mostly rely on basic single instrument peel pouches or small laceration kits rather than massive vendor trays. This would be the correct answer if the question asked where the department dispatches an emergency chest-cracking surgical tray for a sudden cardiac arrest patient arriving via ambulance. Option B. Labor and delivery wards utilize standard delivery and epidural trays which are much lower in volume and complexity compared to major orthopedic or neurological surgical cases. This would be the correct answer if the question asked which specific department strictly requests specialized obstetric forceps and umbilical cord scissors. Option C. Supply chain is a logistical partner that helps manage the hospital bulk consumable inventory. They are not a clinical end user of processed surgical tools. This would be the correct answer if the technician was asked which department must be contacted to increase the periodic automatic replenishment levels for disposable biological indicator vials. Concept extension. Effective communication between the sterile processing leadership and the operating room charge nurse is absolutely essential to anticipate daily surgical schedule changes, prioritize immediate instrument turnovers, and prevent critical delays in patient care. Question 93. During the clean assembly phase, a technician unboxes a shipment of specialized trocar cannulas and examines the manufacturer labeling. They observe a universally standardized graphic featuring the numeral 2 encased within a circle and bisected by a diagonal slash. What specific physical handling directive does this symbol legally mandate? Option A. The device belongs to a specific manufacturing batch and requires lot tracking. Option B. The item possesses a definitive expiration date and must be discarded if unused by that time. Option C. The instrument is validated for one surgical procedure only and must be discarded rather than reprocessed. Option D. The graphic indicates the exact calendar date the instrument was fabricated at the manufacturing plant. Correct answer C. Knowledge point explanation. Core rationale. Medical packaging utilizes standardized international symbols to communicate critical safety parameters across all languages. A numeral 2 inside a circle with a slash passing through it universally signifies do not reuse. This dictates that the item is a single-use disposable device that cannot withstand the rigorous physical stresses of the decontamination and sterilization process and must be thrown away after one patient encounter. Trap analysis. Option A. The lot number is legally required for recalls, but it is not represented by this numerical slash graphic. This would be the correct answer if the technician observed the capitalized letters lot position directly adjacent to an alphanumeric tracking code. Option B. The expiration date signifies when the sterile barrier is no longer guaranteed, not whether the item can be washed and reused. This would be the correct answer if the technician observed the standardized graphic depicting a stylized sand hourglass. Option D. The manufacturing date informs the facility when the item was built, which is separate from its single-use status. This would be the correct answer if the technician observed a graphic silhouette depicting a factory building with a date printed next to it. Concept extension. If a healthcare facility attempts to clean, sterilize, and reuse a device marked with this single-use symbol, they legally assume all liability as the manufacturer if that device subsequently fails and injures a patient during surgery. Question 94. While spending 6 consecutive hours manually brushing heavy orthopedic reamers at the decontamination sink, an SP technician experiences severe shooting pain in their wrist and forearm. In the context of occupational health and physical body mechanics, how is this specific category of nerve and tendon injury officially classified? Option A. A musculoskeletal disorder. Option B. A foundational ergonomic disorder. Option C. A psychosocial work and life imbalance. Option D. A localized work-related arthritic joint disease. Correct answer A. Knowledge point explanation. Core rationale. Sterile processing is highly physically demanding, requiring repetitive motions, heavy lifting, and prolonged standing. Injuries that specifically damage the body muscles, nerves, tendons, ligaments, or joints due to these repetitive physical stressors are officially classified as musculoskeletal disorders. Examples include carpal tunnel syndrome, rotator cuff tendinitis, and lower back strains. Trap analysis. Option B. Ergonomics is the scientific study of designing the workplace to fit the worker to prevent injuries. It is the solution, not the medical name of the injury itself. This would be the correct answer if the question asked to name the scientific discipline utilized to adjust the height of the assembly tables to prevent technician back pain. Option C. Psychosocial issues relate to mental stress, fatigue, and burnout, not direct physical trauma to tissues. This would be the correct answer if the technician was reporting severe insomnia and anxiety resulting from constantly being forced to work mandatory overtime shifts in an understaffed department. Option D. Arthritis strictly refers to the inflammation of a joint, which is only one narrow subset of this broader injury category that also includes muscles and nerves. This would be the correct answer if the technician was diagnosed specifically with osteoarthritis in their knees from decades of standing on hard, unpadded concrete floors. Concept extension. Facilities must implement active ergonomic interventions such as providing anti-fatigue floor mats and height-adjustable sinks to proactively minimize the repetitive strain forces that cause these debilitating occupational injuries. Question 95. While physically pulling long-reach bowel clamps for an upcoming gastroenterostomy procedure, an assembly technician mentally breaks down the complex medical term on the printed preference card. In the structural anatomy of this specific word, what is the sole linguistic function of the letter O connecting the two root elements? Option A. To fundamentally define the primary anatomical body part being operated on. Option B. To dictate the specific surgical action occurring at the end of the procedure. Option C. To seamlessly connect the word fragments and facilitate a smoother vocal pronunciation. Option D. To physically link a modifying prefix directly to the terminal procedural suffix. Correct answer C. Knowledge point explanation. Core rationale. Medical terms are constructed using prefixes, roots, and suffixes. When combining multiple word elements, especially two roots ending and starting with hard consonants, a combining vowel is utilized. This vowel, almost universally the letter O, carries absolutely no independent medical meaning. Its only function is to bridge the elements together to make the complex term easier to pronounce. Trap analysis. Option A. Defining the anatomical subject is the job of the root word, not the combining vowel. This would be the correct answer if the technician was asked to identify the specific structural role of the linguistic element gaster within the complex terminology. Option B. Dictating the surgical action is the job of the suffix located at the end of the word. This would be the correct answer if the technician was asked to identify the specific structural role of the linguistic element ostomy, which means creating an artificial opening. Option D. Combining vowels connect roots to other roots or roots to suffixes. They do not string prefixes directly to suffixes without a foundational root in between. This would be the correct answer if the question asked to describe the function of a hyphen in a hyphenated compound word, a structure rarely utilized in standard medical terminology. Concept extension. A foundational grasp of medical terminology allows the technician to immediately deduce that a gastroenterostomy involves both the stomach and the intestines, ensuring they do not accidentally omit critical long-reach bowel clamps from the surgical tray. Question 96. While actively receiving a sealed transport container of soiled orthopedic instruments from the surgical core, a decontamination technician evaluates the effectiveness of the initial point-of-use preparation performed by the scrub nurse. Which of the following physical outcomes is specifically excluded from the objectives of this preliminary bedside intervention? Option A. To completely and thoroughly eradicate all bioburden from the complex instrumentation. Option B. To manually wipe away massive chunks of visible gross soil from the metal surfaces. Option C. To prevent the onset of corrosive damage caused by blood drying within the box locks. Option D. To secure the hazardous bioburden to maintain the safety of the transport personnel. Correct answer A. Knowledge point explanation. Core rationale. Point-of-use treatment is a critical initial step designed to remove gross soil, halt the degradation of stainless steel, and safely contain the biohazard for transport. However, it is fundamentally impossible to achieve a thorough, complete cleaning in the operating room. Comprehensive decontamination requires the dedicated multi-bay sinks, automated washers, and specialized enzymatic chemicals available only within the sterile processing department. Trap analysis. Option B. This is wrong for this scenario because wiping off gross soil is a primary mandatory action required at the point of use to prevent bioburden from hardening. This would be the correct answer if the question asked to identify the very first physical action a scrub nurse should take to prepare a bloody retractor for transport. Option C. This is wrong for this scenario because applying moisture-retaining sprays at the bedside is explicitly designed to halt the corrosive damage caused by dried blood. This would be the correct answer if the technician was asked to explain the chemical purpose of applying a specialized enzymatic foam immediately after the surgical incision is closed. Option D. This is wrong for this scenario because containing the items in a sealed puncture-proof bin is an absolute requirement to protect the individuals moving the cart. This would be the correct answer if the question asked what specific logistical action ensures that hallway pedestrians are not exposed to infectious aerosols during transit. Concept extension. If point-of-use treatment is routinely skipped by the clinical staff, the decontamination technician will be forced to employ aggressively prolonged soaking times and rigorous mechanical brushing to chisel away the cement-like dried biofilms, drastically delaying tray turnaround times. Question 97. While physically unloading a cooling cart from the steam autoclave, an SP technician discovers 3 heavy orthopedic sets completely soaked with internal moisture and immediately scans them into the tracking system as wet packs. How does the departmental leadership physically utilize this specific flagged metric within the comprehensive quality management program? Option A. They utilize it as a benchmark to determine precisely how effectively the processing team is achieving its established departmental safety objectives. Option B. They use it as an isolated reactive tool to immediately terminate employees who accidentally assemble the compromised trays. Option C. They deploy it solely during unannounced federal surveys to mathematically prove the sterilizers are functioning properly. Option D. They review the metric once annually to satisfy the fundamental documentation requirements of the facility human resources department. Correct answer A. Knowledge point explanation. Core rationale. Quality control indicators are measurable data points that provide a clear picture of departmental performance. By continuously tracking metrics like wet pack rates, biological failures, or missing instruments, the manager can objectively evaluate if the department is meeting its quality goals and identify specific areas where staff education or mechanical maintenance must be aggressively improved. Trap analysis. Option B. This is wrong for this scenario because modern quality programs focus on systemic process improvement, not punitive action against individual frontline workers. This would be the correct answer if the question asked to describe the hallmark characteristic of a toxic, obsolete, blame-based management culture. Option C. This is wrong for this scenario because these metrics must be monitored continuously on a daily or weekly basis internally, not just hoarded for external inspectors. This would be the correct answer if the question asked what specific printout data a surveyor requests to verify the mechanical parameters of a single specific autoclave cycle. Option D. This is wrong for this scenario because reviewing quality metrics only once a year is dangerously infrequent and completely fails to capture active ongoing processing trends. This would be the correct answer if the question asked about the required frequency for conducting a mandatory generalized facility-wide fire safety training module. Concept extension. If the indicator reveals a sudden spike in wet packs, the manager must initiate a root cause analysis to determine if the issue stems from an overloaded sterilizer carriage, poor quality steam, or insufficient drying times. Question 98. A technician in the sterile core is loading a dedicated enclosed wheeled carriage with a highly specific assortment of sterile trays and disposable supplies matched exactly to a scheduled total knee arthroplasty. Which specialized inventory distribution model is the technician actively executing? Option A. The individualized surgical case cart protocol. Option B. The automated periodic replenishment system. Option C. The bulk departmental exchange cart model. Option D. The ad hoc clinical requisition distribution system. Correct answer A. Knowledge point explanation. Core rationale. The case cart system is specifically designed to support the operating room. A sterile processing technician utilizes a physician preference card to pick every precise instrument set and soft good required for one individual unique surgical procedure, loading them onto a dedicated cart that is delivered directly to the specific operating suite just prior to the incision. Trap analysis. Option B. This is wrong for this scenario because a periodic system tops off baseline stock for a general department. It does not build custom setups for individual patient surgeries. This would be the correct answer if the technician was walking the intensive care unit hallways with a scanner to refill their standardized bandage bins to a predetermined level. Option C. This is wrong for this scenario because an exchange cart swaps a fully loaded bulk supply rack for an empty one to service a whole ward, not a single surgery. This would be the correct answer if the technician was pushing an identical fully stocked rolling shelving unit onto the maternity floor to physically swap out their depleted supply rack. Option D. This is wrong for this scenario because a requisition is an on-demand request for a single missing item, not the proactive assembly of an entire procedural cart. This would be the correct answer if the technician received an urgent electronic message from a circulating nurse asking for one specific titanium implant screw to be run up to the room immediately. Concept extension. The efficiency of the case cart system relies entirely on the clinical staff accurately updating their preference cards. If a surgeon changes their preferred glove size and fails to update the card, the sterile processing technician will continuously pick the wrong item. Question 99. While physically organizing the newly renovated sterile storage zone, an SP technician must place the most delicate, infrequently used cardiovascular implant trays into the most heavily protected storage units available. To provide the maximum environmental defense against airborne dust and accidental physical contact, which architectural style of shelving must the technician utilize? Option A. A completely closed cabinet structure featuring solid protective doors. Option B. A standard open-wire rack system that promotes maximum ambient airflow. Option C. A specialized semi-closed unit lacking a front barrier. Option D. A high-density mobile track system designed primarily for space conservation. Correct answer A. Knowledge point explanation. Core rationale. Sterile storage areas utilize various shelving types, but closed shelving is universally recognized as the absolute system of choice for optimal protection. Cabinets equipped with solid sealable doors completely isolate the sterile packages from ambient dust accumulation, moisture fluctuations, and the friction of passing foot traffic, making them ideal for storing expensive, infrequently used surgical implants. Trap analysis. Option B. This is wrong for this scenario because open-wire racks offer zero protection against settling dust or accidental physical bumps from passing transport carts. This would be the correct answer if the technician was loading frequently turned over, rapidly consumed basic instrument sets in a highly climate-controlled interior corridor where items never sit long enough to accumulate dust. Option C. This is wrong for this scenario because leaving the front exposed still allows airborne contaminants to settle directly onto the sterile wrappers over time. This would be the correct answer if the technician was utilizing an intermediate storage rack where items are held only briefly before being actively loaded onto outgoing surgical case carts. Option D. This is wrong for this scenario because mobile tracks describe how the shelves move across the floor to eliminate aisles, not the physical degree of closure or protection they offer to the contents. This would be the correct answer if the manager was seeking an engineering solution to double the department total storage capacity within a severely confined square footage footprint. Concept extension. Regardless of the shelving style chosen, all sterile storage units must position their absolute lowest shelf solid and exactly 8 to 10 inches completely off the floor to prevent splash contamination during routine janitorial mopping. Question 100. A technician is physically transferring a load of heat-sensitive plastic catheters from an ethylene oxide sterilizer directly into a heated ventilated cabinet. What is the fundamental physical objective of subjecting these specific polymer devices to this mandatory extended outgassing phase? Option A. to aggressively purge toxic carcinogenic chemical residues from the porous materials so they can be handled safely by clinical staff. Option B, to forcefully extract trapped ambient atmospheric air from the internal lumens of the catheters prior to packaging. Option C, to rapidly evaporate condensed water droplets to prevent the formation of compromised wet packs. Option D, to actively lower the intense thermal mass of the instruments so they do not cause contact burns to the operating room nurses. Correct answer A. Knowledge point explanation. Core rationale: ethylene oxide is an exceptionally lethal carcinogenic alkylating gas that penetrates deeply into plastics, rubbers, and porous polymers during sterilization. To prevent this toxic gas from burning the patient internal tissue or harming the clinical staff, the processed items must undergo an extended aeration phase where continuous warm air mechanically flushes the residual toxic vapors out of the materials and safely exhausts them to the outside atmosphere. Trap analysis. Option B. This is wrong for this scenario because extracting air from lumens happens during the initial pre-vacuum conditioning phase of the sterilizer, not the post-cycle aeration cabinet. This would be the correct answer if the technician was explaining the purpose of the first mechanical deep draw vacuum pulse initiated at the very beginning of the cycle. Option C. This is wrong for this scenario because ethylene oxide is a dry low-temperature gas process that does not generate massive amounts of condensate like steam cycles do. This would be the correct answer if the technician was explaining the purpose of leaving a hot heavy orthopedic tray completely untouched on a wire rack for 2 hours after pulling it from a steam autoclave. Option D. This is wrong for this scenario because low-temperature sterilization processes operate well below the threshold that causes severe physical contact burns. This would be the correct answer if the technician was detailing the specific reason why massive metal vendor trays must be allowed to rest on a specialized cooling cart immediately following a 270 Fahrenheit steam exposure. Concept extension. The duration of the aeration phase is strictly dictated by the manufacturer of the medical device being sterilized, not the operator of the machine, and can often require up to 12 hours of continuous outgassing for complex polymer implants. Question 101. While manually evaluating a Kelly hemostat at the illuminated assembly workstation, an SP technician tests the interlocking teeth mechanism situated between the finger rings. What is the specific anatomical term for this component that allows the surgical user to secure the jaws at a precise clamping pressure? Option A. The ratcheting mechanism. Option B. The distal grasping serrations. Option C. The elongated metal shank. Option D. The central pivoting box lock. Correct answer A. Knowledge point explanation. Core rationale: ring-handled surgical instruments designed for clamping feature a ratchet. This specific physical mechanism consists of interlocking metal teeth located near the finger rings, allowing the surgeon to forcefully lock the instrument jaws closed onto tissue or vessels without needing to maintain continuous manual hand pressure. Trap analysis. Option B. This is wrong for this scenario because serrations are the physical grooves cut into the working jaws to grip tissue, not the locking mechanism near the handles. This would be the correct answer if the technician was using a lighted magnifier to inspect the distal tips of a needle holder for retained biological debris. Option C. This is wrong for this scenario because the shank is merely the solid metal body segment bridging the handle to the working joint. This would be the correct answer if the technician was measuring the total overall length of the instrument from the finger rings up to the primary hinge point. Option D. This is wrong for this scenario because the box lock is the mechanical hinge where the two halves of the instrument intersect, not the locking teeth. This would be the correct answer if the technician was rigorously applying a water-soluble antimicrobial lubricant strictly to the primary friction point of the hemostat. Concept extension. During the inspection phase, the technician must physically snap the ratchet closed to its first tooth and gently tap the instrument against the padded workstation to ensure the locking mechanism does not spontaneously spring open under tension. Question 102. An SP technician is physically pushing a covered transport cart containing a dropped orthopedic drill toward the substerile core rapid processing autoclave. To maintain strict compliance with joint perioperative mandates, what fundamental operational directive must govern the physical execution of this expedited steam cycle? Option A. The deployment of this specific rapid cycle must be aggressively minimized and restricted strictly to unpredictable clinical emergencies like this dropped instrument. Option B. The procedure must be physically confined to a single designated autoclave unit per healthcare campus. Option C. The technician must procure a specific operational exemption directly from federal device regulators before loading the chamber. Option D. The mechanical operation of this sterilizer must be exclusively restricted to certified central processing technicians, preventing nurses from touching the controls. Correct answer A. Knowledge point explanation. Core rationale. Immediate use steam sterilization skips critical drying and quarantine phases, inherently increasing the risk of wet packs and transit contamination. Therefore, leading healthcare accreditation and surgical nursing bodies dictate that this rapid physical process must be aggressively minimized and used exclusively when an item is dropped or critically needed immediately, never as a substitute for adequate routine instrument inventory. Trap analysis. Option B. This is wrong for this scenario because there is no geographical restriction limiting a hospital to a single machine. Many operating room suites have multiple units. This would be the correct answer if the question asked to describe the facility layout requirement for housing a highly toxic dedicated ethylene oxide processing chamber. Option C. This is wrong for this scenario because federal agencies approve the manufacturing of the physical machine, not the daily clinical practice of the hospital utilizing it. This would be the correct answer if the facility was attempting to legally introduce a completely experimental and proven chemical gas sterilization technology into the clinical workflow. Option D. This is wrong for this scenario because fully trained perioperative nurses frequently load and operate these specific machines located directly inside the surgical core. This would be the correct answer if the question asked who is exclusively authorized to program and run the massive centralized terminal steam autoclaves located down in the main sterile processing department. Concept extension. When auditing these specific records, the leadership must ensure the circulating nurse or technician physically documented the precise clinical reason for the emergency cycle, such as dropped cranial drill, to prove it was not processed merely to save turnaround time. Question 103. While meticulously loading a massive gravity displacement autoclave, an SP technician visually verifies the biological indicator vial positioning. They mentally review how the pressurized steam physically breaches the outer cellular membranes of the test spores to permanently coagulate the vital proteins housed within which specific centralized cellular command structure. Option A. The microscopic cytoplasm. Option B. The genetic nucleus. Option C. The outer cell membrane. Option D. The protective external capsule. Correct answer B. Knowledge point explanation. Core rationale. In microbiology, understanding cellular anatomy reveals how decontamination and sterilization physically destroy pathogens. The nucleus is the fundamental command center of a living cell, acting as the protective vault for the organism hereditary deoxyribonucleic acid and actively governing all metabolic and reproductive functions. Trap analysis. Option A. This is wrong for this scenario because this structure is the gelatinous fluid matrix filling the cell interior, not the central command center containing the genetic code. This would be the correct answer if the educator asked the trainee to identify the specific aqueous environment where standard cellular metabolic reactions continuously occur. Option C. This is wrong for this scenario because this is the semi-permeable exterior skin enclosing the cell, not the internal brain of the organism. This would be the correct answer if the educator asked the trainee to identify the specific boundary layer that physically controls the absorption of nutrients and the expulsion of waste products. Option D. This is wrong for this scenario because this is an extra layer of highly resilient slime secreted by only certain bacteria to defend against harsh environments. This would be the correct answer if the educator was explaining the anatomical feature that allows highly resilient pathogens to actively resist initial phagocytosis by human white blood cells. Concept extension. Thermal sterilization modalities are exceptionally effective because the pressurized moisture physically breaches the outer cellular membranes to permanently coagulate the vital proteins residing within the nucleus, ensuring absolute organism death. Question 104. An SP technician is preparing to push a heavily loaded closed transport cart directly into an active restricted surgical suite to deliver an emergency trauma tray. While donning the mandatory facility-issued scrub attire, head covering and facial mask, which specific piece of personal protective apparel is officially deemed optional by national infection control guidelines for this physical area? Option A, the facility-laundered surgical scrub suit. Option B, the fluid-resistant protective shoe covers. Option C, the bouffant cap securing all cranial hair. Option D, the standard surgical face mask. Correct answer B. Knowledge point explanation. Core rationale. While sterile processing technicians heavily utilize fluid-resistant shoe covers in the decontamination zone to protect themselves from hazardous splashes, leading perioperative infection control organizations classify them as optional in the restricted operating room. They are not scientifically proven to reduce environmental surgical site infections and are primarily worn only if the individual worker anticipates massive floor fluid exposure. Trap analysis. Option A. This is wrong for this scenario because standard street clothes are strictly forbidden. Facility laundered uniforms are the absolute baseline requirement for crossing into the semi-restricted corridors. This would be the correct answer if the question asked to identify the foundational layer of clothing required before a technician can physically enter the clean assembly room. Option C. This is wrong for this scenario because containing shed hair and squamous cells is a critical non-negotiable requirement for entering any restricted zone. This would be the correct answer if the question asked to identify the very first physical piece of barrier apparel a technician must don before putting on their scrub top to prevent dandruff fallout. Option D. This is wrong for this scenario because the active surgical suite is a restricted zone where exposed sterile instruments demand strict droplet protection over the mouth and nose. This would be the correct answer if the question asked to identify the specific physical barrier required to filter exhaled respiratory aerosols in the presence of open surgical trays. Concept extension. If a technician chooses to wear shoe covers into the operating room, they must physically remove them and perform immediate hand hygiene the precise moment they exit that restricted suite to prevent tracking potential biohazards throughout the general hospital hallways. Question 105. At the commencement of the morning shift in the decontamination zone, a technician physically removes the heavy metal strainer from the bottom basin of the automated washer disinfector to clear away trapped bone fragments and suture strings. According to strict equipment maintenance guidelines, what is the absolute minimum required frequency for physically extracting and clearing the specific filtration component? Option A. At least once per every standard 24-hour operating day. Option B. Exclusively at the conclusion of every individual 8-hour shift. Option C. At the termination of the standard 5-day operational work week. Option D. On the first calendar day of every subsequent month. Correct answer A. Knowledge point explanation. Core rationale. Automated mechanical washers rely on forceful water impingement to physically blast soil off instruments. The large debris filters located in the bottom basin capture bioburden to prevent the internal spray arms from clogging. To ensure adequate water pressure is maintained, equipment standards legally dictate that these screens must be manually removed, inspected, and thoroughly cleaned a minimum of once daily. Trap analysis. Option B. This is wrong for this scenario because while cleaning the screen every shift is an excellent, highly recommended practice for busy facilities, it exceeds the mandated bare minimum requirement of daily maintenance. This would be the correct answer if the question asked to identify the elevated preventative maintenance protocol implemented by an exceptionally high-volume trauma center running consecutive contaminated loads. Option C. This is wrong for this scenario because waiting 5 days allows massive amounts of coagulated blood and bone cement to calcify inside the mesh, completely starving the machine primary intake pump of water. This would be the correct answer if the technician was establishing the testing frequency for initiating a routine flushing protocol on the department eyewash stations. Option D. This is wrong for this scenario because a monthly inspection schedule would instantly guarantee catastrophic mechanical failure of the washer disinfector due to severe fluid blockage. This would be the correct answer if the technician was scheduling the replacement interval for the heavy-duty external air intake filters mounted on an ozone sterilization cabinet. Concept extension. If the internal rotary spray arms of the washer become visibly clogged due to a neglected debris screen, the technician must manually unthread the arms, utilize a specialized stylet to clear the individual jet nozzles, and rerun the entire wash cycle.